And we are recording this session. So if you know people who wanted to come and just couldn't make it, Carrie, what are the instructions for accessing the recording after the fact?
Yes. About next week, the recordings will be available on the website, and be sure to check the announcements.
Okay, so we'll be going out in the announcements, but if for some reason you can't find them, have any questions about our Health Council talks, just email us, I think info@nmhealthcouncils.org. So again, welcome folks. A few more people coming on here, looks like. Oh, Misty, Be Well, New Mexico. Thank you for being on. We are going to be talking about how to make sure you're signed up for health insurance coming up. Shay, Joanne, hi, Barry, hello. Nice to see people. So we'll give it let's give it one more minute. See if people are still coming on board here. So again, those folks that are coming in, if you'll introduce yourself in the chat, that would be great. Appreciate that. And the meeting is being recorded. So if you know anyone who missed it, they can come back and capture this important information. So you've heard that we were going to hear from Aging and Long-Term Services, but I don't believe they will be with us today, but no fear. We've got Chris Gomez from Western Sky, and he's going to tell us the latest about how to make sure that you are signed up for health insurance, especially Medicaid. As you know, with the expiration of some of those COVID emergency measures, Chris is going to correct anything I say now that's wrong, but my understanding is that you really have to be sure you may have to reapply. So make sure we get this information, make sure you take this information down and pass it along, because we want everybody to make sure that they have health insurance. And who is here from Misty? Misty from Be Well, New Mexico. I think we'll have time if there's some additional information that you can provide from the perspective of Be Well, New Mexico. I'm sure that'll be much appreciated also. So it's 12:02. We're going to start, as we usually do, with our land acknowledgement. So I am going to share my screen. And if you will follow along with me on our land acknowledgement. The New Mexico Alliance of Health Councils humbly recognizes and acknowledges that we are on the unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache Nations, and the Navajo Nation. Together, we acknowledge the history of genocide, possession, colonization, and ongoing systemic inequities, while strengthening and respecting relationships with Indigenous people. We give thanks to the past, present, and future stewards of our land, and we respect all our tribal nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today, and we pledge our support to work with them. So thank you very much for staying with us for that. And now we are going to turn the meeting over to Chris Gomez. A lot of you may know Chris because he is out in the community, but he's going to introduce himself one more time though. If you just joined us, please introduce yourself in the chat. And Chris, we're turning it over to you.
Thank you so much, Wendy, and good afternoon, everybody, and happy Friday. I hope you guys are all having a great day. With the approaching weekend coming on, I'm sure we're all excited for that. As the weather starts to get nicer, it's nice to get outside, right? But today, what I'm really looking forward to doing is sharing some information with you guys. There are some unprecedented events taking place here in New Mexico, and together as if we can bring our state together to help bring awareness to these upcoming events, it's going to be a great way to help make sure that our fellow New Mexicans can have the best possible health outcomes. So on that note, guys, there's a few things I'm going to be covering here today. There is quite a bit I can talk about, but there's a few subjects I want to go ahead and focus on. And then if we have some time, I can definitely go into other subjects as well. But for today, guys, there's a small list here. I'm going to share my screen with you guys briefly here. And these are some of the things I want to cover with you today. Today, I want to talk to you guys a little bit about the redetermination that's coming up, and then some special programs and services that Western Sky Community Care has going on. But the first and the most important is going to be the redetermination for Medicaid and SNAP. Let me give you guys a quick backstory on why this is happening. And it's going to all link back to the pandemic. Because of the COVID-19 pandemic, it created a public health emergency. A lot of us, I'm pretty sure all of us have never been through a pandemic before. So again, it is something that's unprecedented. But what is now happening is because of the pandemic, it created a public health emergency. One thing that did is it created it to where if you were applying for benefits, for instance, Medicaid or food stamps, food assistance, it was basically put on pause for your recertification. Traditionally, you have to recertify every year to ensure that you are still eligible for those programs that you are receiving. However, again, with the public health emergency in effect, it put those recertifications on pause. So all benefits were ongoing until further notice. Well, that further notice is now coming. And that's where we really need your help, is to help educate the community on what this means and what steps they can proactively take to ensure that they do not lose benefits. Again, this is primarily going to affect Medicaid as well as food stamps. So with that being stated, the SNAP benefits. So with that being stated, here's pretty much what's happening. The state's rolling this out in a few different phases, in 3 phases. The first phase is currently happening. They're sending out turquoise envelopes to individuals. The big thing here is just to be on the lookout for information coming from the state. If you have not already, if you may have moved because our community members move sometimes, or they'll change their phone numbers, you're going to want to make sure that your contact information is up to date with the state. That way, if they're trying to reach out to you, you know what's going on and you know how you can take the steps to ensure that you do not lose coverage. So on the screen here, guys, I'm going to send this email to Wendy and ask that she shares it with you guys so you can have all these links available as well. But with that being said, you can learn more in regards to the Renew-NM by going to this site. It talks a little bit about it, again, talking about the importance of getting your contact information up to date. If you receive information requesting that you recertify, the importance of taking those steps and how you can get answers to additional questions that you may have. If somebody is informed that they need to recertify, the process itself is we're trying to keep it as easy as possible. The state really wants to make sure this is seamless. So all individuals have to do is go on to yesnewmexico.com. They can go on to yesnewmexico.com. They're going to sign into their account. Once they sign into their account, they're going to go ahead and click a button that says renew my benefits. Follow the steps, and it's easy as that. They'll find out if they are going to be able to continue receiving coverage or if they're going to look into additional coverage options. And if they do need to get in touch with additional coverage options, a few different things you can do here. One, you can always reach out to me. I'll be glad to help get them in touch with one of the brokers that we work with who can help give them a free at no risk quote. The big difference between Medicaid and the marketplaces, the exchange programs, Obamacare, several names, all the same thing. But with that, one of the biggest differences, the marketplace plans will have a monthly premium to them compared to where Medicaid will not. Medicaid does not have any monthly premiums, so any monthly payments, where the marketplace, the exchange plans will. And those plans are going to be subsidized based on your income, and your family size will determine on what your monthly payments are going to be looking like. The closer somebody is to Medicaid eligible, the lower those monthly premiums are going to look. But again, you can also go to bewell.com. And again, as Wendy mentioned, Misty's on the line, so maybe she can chime in a little bit more about some of the resources they're offering. But again, those are some of the things that are going on right now. So where can you play a part in all this? If you are community facing, helping to inform people about the importance of these steps, the importance of recertifying, You can also just letting them know if you're in doubt, just log on to your Yes New Mexico account. It'll have that renew benefit. You can just follow through those slides and just help ensure that your coverage is set up. But if you guys have questions on that, one of the best things we can also do is be here as a resource. And that's one thing I want to help with. So if you have any questions moving forward, you can certainly reach out to me. You can call, text, or email. Hey, Chris, we got somebody needing help. Can you assist? We'll be glad to share any resources or information that we can on that. So I know that was kind of a lot of info in a little bit of time. Before I proceed, I'd like to open up to see if anybody has any additional questions on the recertification process. All right, looks like we're good there. Again, Missy, I know Wendy had mentioned if you may want to chime in. Is there anything you'd like to add to the recertification in regards through Be Well and M's perspective?
Hi, good morning, everyone. Yeah, so my name is Misty Dickens. I work with Be Well NM, which is, Chris had mentioned, is the health insurance exchange. So on our website at Be Well NM, I don't know if you want to click it, Chris, or since you're already screen sharing.
Yeah, give me 1 second here. I have it on an email format, so I just gotta do this
Oh, okay.
really quick.
I just wanted to highlight our events that are coming up. We try to target the counties with the most people coming off Medicaid. So that would be Bernalillo, Sandoval, Santa Fe, McKinley, San Juan, Doña Ana. And then we do have some more throughout the state. So we do have our toolkit online. Let's see, where is it at?
Is my screen showing, Misty? Sorry to interrupt.
Yes, it is.
Okay, beautiful.
So here we have our replacing Medicaid, our shop and compare tool, which is just our anonymous quoting tool, scheduling an appointment. So we do have certified enrollment counselors and brokers throughout the state. And they just help with the application process. It would be no charge. And then we did just load our event calendar. Oh, there it is. If you click education and enrollment events calendar, we'll be having enrollment events across the state. So our first one is actually tomorrow at the Alamosa Community Center. And then we also will have one in the Pueblo of Zuni and then Santa Fe next Saturday. So if you just go through the months, I think we'll have them through July right now. May and June would have the most events coming up. So there will just be a place you could refer people to if they're needing help with accessing coverage. So we do have both our Native American events on here and then our enrollment events. So everything is loaded here. And then just the other thing is we also have our partner toolkit, and I can put that in the chat. So we just similar to HST's Renew campaign, ours is just really helping with that transition from Medicaid to the marketplace. And like Chris had mentioned, plans could be at no cost or low cost depending on the income and household size of the family. But again, we're just trying to get out into the communities and be available, especially for this in-person assistance. And I think that's it. And I'll go ahead and put that website for the toolkit in the chat.
So in hearing you speak, Misty, it reminded me one important detail here. When it comes to this, the other big thing is when people traditionally with the marketplace, one thing about it is you can usually sign up for the marketplace during open enrollment only, with the exception of special enrollment periods like getting married, having a baby. There's some more negative ones, but we'll keep it positive. So those are some of the things. So special life-changing circumstances can open up special enrollment periods. Well, another one of those is losing insurance. So that's why this is really important that people need to be aware of, is if they do lose their Medicaid coverage, it's going to open up a small window that they're going to have access to. So again, if they're informed they need to recertify, part of this, the Renew campaign, and if they are no longer Medicaid eligible, then they really need to make sure that they are prepared to look into the options through Be Well and M, because that enrollment window will close. And once it closes, they're going to need to wait till the next open enrollment period, which traditionally takes place in October and November. And it switches sometimes. Sometimes it goes into December. Misty, maybe you'd have more information on what it's looking like this year. But long story short, it will not open up until Q4 of this year. And then those plans go into effect for January of 2024. So that's the other huge thing. We don't want people to miss out on their opportunity to keep their health insurance, and vice versa. If they're Medicaid eligible, we don't want them to lose their coverage, think they still have it, go to the doctor and get informed they don't have it there, and then have to deal with all that headaches when they're probably needing to visit the doctor. Is the last thing they want to have to worry about is trying to recertify and get their Medicaid back at that time. And remember, guys, that also does cover SNAP benefits. So that's that food assistance. So we would hate for people to go to the store thinking they have some food stamps on their card and try to utilize those, and they're not available. So again, with proper education, we can prevent a lot of headaches down the road. And the most important thing we can put into perspective is this is a collaborative effort. Together is where we can make the biggest impacts. And with that being said, we want to be here for support. So again, my contact information is in the chat. This email will be coming out shortly. So if you need anything or if you have questions, please do not hesitate to call, text, or email. And if we can assist in any way, shape, or form, please believe we will be doing so. So on that note, guys, with that little bit of additional information, before we move on to some of the next topics here, does anybody have any additional questions on the redetermination, the Renew and M campaign that's currently going on? Pretty good there. All right, excellent. If you guys are like me and you think of something, please just feel free to bring it up here at the end of the presentation. Let me just double check one thing here. Okay, great. I was just checking the chat, make sure there were no messages in there. Now, guys, I want to talk to you a little bit about Western Sky Community Care. For those of you that don't know me, again, I probably should have started off with introductions, right? My name is Chris Gomez. I'm a Senior Community Relations Coordinator with Western Sky Community Care. Western Sky Community Care is one of the managed care organizations in New Mexico. So that's going to be an MCO for short, and that's going to be one of the providers for Medicaid. So if somebody does apply for Medicaid and if they are approved, they'll be able to select Western Sky Community Care, Presbyterian, or Blue Cross Blue Shield. Those are the three current MCOs in New Mexico. In addition to that, if you are Native American, they may have fee-for-service. Native Americans do have the option to choose fee-for-service. All other residents, though, will have to select an MCO if they are Medicaid eligible. So if you ever are working with somebody and they're saying they have Medicaid, but they don't have an MCO, that's because they are classified as a Native American through the state of New Mexico, and they have selected to go with fee-for-service Medicaid. In addition to that, though, guys, there's quite a bit that I want to talk to you about Western Sky Community Care. If you are community facing and if you are working with Western Sky Community Care members, I want to make sure that you know about some of the different programs and services that our agency does offer the community. We bring a lot to our people, and it's all in regards to helping create a better New Mexico. So if you're working with any of our members, please help to share some of this great information with them so they can get the most out of their health plan. One of the first things I want to talk to you guys about are going to be our member advisory board meetings. So I'm going to share this flyer with you. All of the MCOs do member advisory board meetings, and these are going to be great forums where our members can come and join and learn more about their health plan. The goal here is really threefold. So one, we want to make sure that our members are educated. We want to make sure they know about the different programs and services that they have access to. We also want to make sure that they know about the different departments that we have working hard to keep them healthy. As they say, education is key. We want to pass out these keys to help our members open many doors for them. Secondly, we want to give our members a voice. This gives them the opportunity to communicate directly with us as their health plan. One of the best ways to improve is to hear our members' feedback, to learn where they have had good experiences and to find out where they're having troubles or issues. This is the best way that we can improve as a whole. So at this meeting, we invite our members to openly communicate with us so that we can become a better health plan for New Mexico. And last but not least, we support. As a thank you for their time and hopefully the feedback they can share, we send each member that joins a $25 gift card. So it's something really cool that they can utilize. In addition to that, we do these meetings throughout the year. We do 6 of them here at Western Sky Community Care. We are currently we've done 2 so far this year, so we have 4 remaining. So this will be our 3rd member advisory board meeting of 2023. It's taking place on May 18th, Thursday, May 18th at 2 p.m. And it's through Zoom meeting right now. So it's super easy, convenient, and safe to join. We may one day go back to in person or even bring in a hybrid model, but for right now, we are keeping them Zoom. So again, for our members, it's super easy to join. So if you guys do work with the community or if you have community boards, please put this up so our members can learn about it. It's a great way to make sure that they can get the most out of their health plan and learn how we can be here to help keep them as healthy as possible. Before I move on to the next subject, does anybody have any questions around the Western Sky Community Care Member Advisory Board meetings? Awesome. So the next thing I want to talk to you guys about is going to be the baby showers. For anybody here that is working with expecting mothers, we really want to let you guys know about these great benefits. Western Sky brings a ton of benefits for our expecting mommies. And I want to share with you how we can share these resources with our members here today. So let's go ahead and share. Probably easy if we just share the screen here. Can you guys see the flyer right now?
Yes, we can.
Excellent. So this is again going to be a Zoom meeting. So the only and just to let you guys know one thing on the member advisory board meeting as well, anybody is welcome to join those meetings. However, only members will get the $25 gift cards, but you as agencies or community-based organizations are welcome to join and communicate with us. We also hold a special meeting strictly for our community partners, and that one's known as a community advisory board meeting. And that particular meeting, we really want to focus on inviting our community partners to join. So if you work with Western Sky and have feedback for us, we would really love to hear from you as well. So we'll be sending that out a little closer to June. But again, we'd love for you to join, and you are always welcome to join the member advisory boards and advocate for the community-based organization or the agency you're working with and talk to us about how we're doing or ways you feel Western Sky Community Care can improve. But the virtual baby shower, continuing back on to this one, the catch to this one is you just have to have Western Sky Community Care and you have to be expecting. As long as you meet both of those criteria, you're going to be eligible to join this baby shower. Our next one's coming up pretty quickly. It's going to be April 26th, so that's next week. So again, if you're working with any expecting mothers that have Western Sky, please make sure to share this with them. It's a great resource. But what do they get from joining this meeting? So firstly, we're going to educate mommy on how we're here to make sure that she has the best possible pregnancy. We want to make sure that she knows about all the different departments we have to help keep her healthy. If she is a high-risk pregnancy, how care coordination is an option that she can look into. And the main goal is just to make sure mommy and baby have the best possible pregnancy. In addition to that, as a thank you for joining, mommy will get a baby box full of all kinds of great supplies to get her started off in the right direction. Plus, she's going to get her choice of an infant car seat or a pack and play. So all of that is supplied simply for joining the baby showers that we do. So it's a really great resource. So again, if you are working with any expecting mothers, I do ask that you share that information with them, or if you would like hard copies of anything that you're seeing here today, reach out to me. We'll work on mailing that to you or delivering it to your agency.
So Chris,
Yes, ma'am.
Guru Amrit had a request to share the link for the member advisory board meeting flyer. And it sounds like you are ready, willing, and able to share any of this material
Mhm.
with anyone who asks. So perhaps you could put your email address into the chat once
Yeah.
more.
And I certainly will do that. As soon as I'm done presenting, Wendy, I'll put that in. I'm
Okay.
also going to send you the attached email here with the attached flyer. So on all of these flyers, it has the digital link. So you can click those at the meeting time. It'll take you right to the meeting. So these are, each of these flyers have the hyperlink right in them. You can click that, it'll send you right to them. We do ask though that if you are wanting to join, if you can just RSVP with us by emailing this email here. Just email us and let us know you'd like to join. And we ask that for the members as well. If any member wants to join, if they could just email us first, we can get them RSVP'd. It makes the attendance process a little easier for us when they join on. But all this information, this email that you're seeing here, everybody, is the one I'll send out. But by all means, I'll certainly be putting my email again so you can reach out to me. And if you find this information helpful today and you're like, well, Chris, I'd really like you to come talk to our team about this, or maybe something that's a little bit more specific to your agency that Western Sky Community Care provides, we'd love to set that up and come and speak with your agency or your community-based organization to share these resources and educate and help answer any questions that you guys may have so that you always feel comfortable and confident working with Western Sky. To carry on, guys, I just have a few more subjects I want to make. I'm not going to go into every single one here, but I do want to talk to you guys briefly now. Well, really quick, any additional questions on the baby shower before we move on to the value-added services? All right, so moving on to the value-added service flyer. Is the flyer sharing or is it still the email screen sharing?
No, the flyer is not visible.
Okay, thank you, Wendy. I
You're
have
not
two
sharing your
screens
screen
open.
yet.
Yeah, I have two screens open.
There we go.
So it I never know which one's showing here, but this is going to be our value-added service flyer. So I want to give you guys a quick breakdown on Medicaid and what coverage actually comes with it. So when somebody applies for Medicaid, firstly, there's four main things that they need to check off to get approved for it. One, you have to be a citizen. You have to be a citizen of the United States. Two, to get New Mexico, you have to be a resident of New Mexico. That basically just means that you've lived here for 30 days and you plan on staying in the state. The next thing, it's going to be based off of income and family size. So if you check all of those off and you are Medicaid eligible, then you will be approved for Medicaid. With that being stated, once you get approved for Medicaid, there's a few benefits you get. The first are going to be 5 core benefits. So it consists of complete medical care, including behavioral health. We help with vision benefits. We help with dental services. We help with transportation, and we help with pregnancies. So those are the 5 core benefits that you get when you get approved for Medicaid. And they're known as covered benefits. But with that being stated, what makes us different, right? What makes each of the MCOs different from one another? Firstly, is going to be the network. Although you get the same level of care, where you get that care through will determine on the networks that each of the MCOs has established. In addition to that, what makes us different are going to be these. These are known as value-added services. Value-added services are special programs and services that our members have access to for being a part of the health plan. Some of the value-added services are available to all members. Some are available to members of certain demographics, and some are available to members with a prior authorization. So those are just some things to keep in mind. Requesting value-added services is as easy as reaching out to our member services department and letting us know that you would like to look into requesting or learn more about a specific value-added service, and then we can help with that. For the sake of time here today, guys, I'm not going to go over every single one in detail. I'm just going to quickly touch base on some. But these two are really combined. So our Native American Traditional Healing Benefit and our Holistic Care Grant are basically very similar. The big difference is this one is available to our Native American members, as this one is available to all other members. These are $250 gift cards that we send to our members that they can use towards health essentials that they may need. The benefits are endless and huge. It's something that we know helps a lot of our members out. The catch to it is basically the following. You can request one per calendar year. You can request one per household for the Holistic Care Grant and one per member for the Native American traditional healing benefit. And then last but not least, they're both available while supplies last. As you can imagine, these are one of our more popular value-added services, so they do not traditionally last too long. We have a few of them left, but we do know they are running out soon. We also offer a PICS Health application. This is something we're really excited about that's been helping a lot of our members. It's a very cool application to help reduce social isolation and loneliness. Our members can log on and interact with a friendly chatbot, and this chatbot can help share resources, connect them with us as needed, and just make sure that our member has all the support they may need. There's a lot more that goes into this application, and if you guys are interested in learning more, please let me know. We have life skills coaching for any of our members that have traumatic brain injury or acquired brain injury. We can help get them in touch with a coach, with a brain specialist support, with experienced coach with a brain injury specialist support. And it's just a great service that they're going to have access to. We talked a little bit about the baby shower. So that's another thing that we'll do here by helping them get that infant car seat or that pack and play. Home modifications are available with prior authorizations, really to help fall related risks. We touch base on the holistic care grant. We also offer a sober living home. So that's a really great resource. This one will help our members that are in need of a safe place to stay while actively engaging in intense outpatient services, outpatient substance abuse services. We help with eyeglass repair and replacement. One thing Western Sky does is not only do we cover our glasses for our adult members, but for the children and the adults, we help with replacement pairs. So if you lose, break, or if your prescription changes within a 12-month period, we help you get a new one. We have doula programs available to any of our expecting mommies. We offer full Medicaid services for anybody who is pregnant. Transportation to the pharmacy is something we can help with. If you are hospitalized, we can help with picking up your prescriptions up to 7 days post-discharge. We help with transition packs. These are going to be for children that are going to be transitioning from an out-of-home placement, such as a residential treatment center, treatment foster care, or group homes. We have True Fit. This is for our developmentally disabled members. It's a fitness application to help them stay as healthy as possible. We help with tablet and smartphone programs. This is going to be for really to help with behavioral health telemedicine for our members in a nursing facility and assisted living facilities. Post-discharge meals, again, if you are hospitalized upon discharge, we can help with 10 healthy home-delivered meals. This does include the delivery of a new baby. We help with electroconvulsive therapy with the prior authorization. We have help with heading home respite beds. This is more for the central Albuquerque area. We have a bridge program. This helps with timely discharges from an RTC. And it's just a way to incentivize going into treatment foster cares. And then we also help with a thank you caregiver package for any of our members that have caregivers. We can help give them a thank you package for all the hard work that they do for our members. So those are some of the special value-added services that we offer to our members. I know that I kind of covered that quickly, guys, for the sake of time, but does anybody have any questions on the value-added services that Western Sky Community Care offers? Awesome. If you do have any questions, again, you'll have this flyer. Feel free to review and feel free to reach out to me if you'd like more information on any of those value-added services or just any in general questions that you may have. The last thing I want to talk to you guys about is Western Sky does also offer micro grants. So we are working with the Community Foundation of Southern New Mexico, and we are currently offering grants in Doñana, Luna, Hidalgo, Eddy, Lee, Chavez, and Sierra County. So if any of you guys are joining from these counties and are joining as a nonprofit or no nonprofits in this area that could utilize some grants, please have them review these measures here. If they meet any of these measures, or if these are measures that they're currently working to address, we would love to actively invite them to apply for these micro grants. They can apply at this website here, and they have till May 20th at 5 p.m. to apply for these grants. But these grants are really cool, and it's something that we are utilizing to really help create a better New Mexico. So again, if you are a nonprofit in any of the listed counties here, I do invite you to apply for one of our one of our micro grants. And I ask that if you have any questions on that, to please let me know now, and I'd love to help address any questions you may have.
Yeah, I have a question. Hi, my name is Valerie, and I work with a local nonprofit organization that serves many of those counties mentioned. And I think that this would be a great opportunity for us to engage. I'm seeing a lot of these bullet points are applicable to the counties that we serve. So yeah, I would love to have an email with that information on it to look at.
Thank you, Valerie. Yes, yes, please put in that application. Again, the Community Foundation is who will review those grant applications and help with that. But in a worst case scenario, if one of the grants, if you are not selected as one of the awardees, keep me in mind. I'm always looking. These are measures that us as a health plan are always working to address as well. So again, you'll get this email through the listserv. However, if you have additional questions, or if you would just like to reach out to me and get to know me better and explore some of that common ground we share, I would love to do that. And that's something I invite to everybody on the call as well. For those of you that don't know me, I would love to get to know you better. As I mentioned earlier, it's only together that we can really make the biggest impact. So I would love to get to know you guys and explore common ground we share and ways we can work together to really help improve the health of our communities. Sarah, I think you have a question as well.
I do. I did put it up in the chat, but I'll go ahead and ask it verbally as well. My question is, you said for the micro grants that the organization has to be a nonprofit. A lot of our health councils use fiscal agents that are nonprofit. Would that be eligible or not?
That would 100% be eligible.
Okay.
The only thing is, again, for anybody in here, whoever's done grant writing, I'm sure we can all agree it can sometimes be a little tedious. So that's the one thing about it. Again, you just really want to use this platform, your grant, to just paint that picture, right? State how it's going to make that difference. That's really what they're looking into. They want, the ones they usually go with are the ones that show that are going to make the greatest impact. So just a little heads up, when you're writing your grant, when you can put in some sort of data or how that data is going to be tracked, that stuff usually goes a lot further when they're reviewing those applications. But by all means, yes, Sarah, any nonprofit in these areas is welcome to go ahead and apply for this grant. And then it'll be reviewed. And like I mentioned, if for some reason those don't go through, just get in touch with me. And I'd love to find some ways we can share. We can explore ways we can potentially work together to make some really, really big differences. Yes.
Chris, did you see the question? We have several people from Catron County here, and Barbara would like to know if you're going to expand into Catron County anytime soon. Can you work with the folks in Catron County?
I would love to work with Catron County, honestly. Yes, I'm actually going to Catron County next week. We're bringing down some backpacks. We're getting some backpacks to Hidalgo Medical Services to pass out at a student resource fair they're doing. And then we're also giving them some additional backpacks for back to school this year. But Catron County is an area that I'm really looking to get more involved in. So I would truly love to meet with you. It's not currently on here, but if there is a need in Catron County that you guys are seeing, like one of the biggest things I think we can all agree on is New Mexico is huge. It's so big, and each territory has its own needs and almost its own culture. And I live in Las Cruces, if I didn't mention that, but I cover all of Southwest New Mexico right now. And even my area of just South New Mexico is so different. So I would love to get to know you better. I believe you mentioned it was Barbara. Barbara, if you can email me, I'd love to get to know you better. Maybe we could set up a Zoom meeting, have some communications, and talk about some ways Western Sky Community Care can show some love and support over there in Catron County. And let's see here. I saw somebody else had their arm raised a moment ago. Did you have a question?
Chris, that was me, Geraldine. But I asked it in chat is to just post the link for the micro grant, please.
Definitely. I'll do this one right now, guys, just to keep it easy. I'm going to just go ahead and pop this link in there right now, just so you guys can have it.
And we will be sending out this information to everyone, and Carrie, you and I'll work together on how to get all this information out to folks, right?
And as promised, I just put my contact information in the chat as well. So if you guys would be so kind just reach out to me if we have not met already. I think that's a shame. There's so many great people in this meeting. I'd love to get better acquainted with you guys and explore some ways we can truly work together to do the most good. That's ideally what I like to do, is work with people who have deep roots in the ground in the communities they're serving and understand where the biggest impacts can come. I really like to make sure that we work smarter, not harder. And when you're working with somebody who is really involved and cares for their community, they know how to make the biggest impacts. And that's something that we really want to strive for here at Western Sky Community Co. So with that being said, guys, I know that was a ton of information in a little bit of time, right? That was a lot of stuff to take in one sitting. But with that being said, I'd love to open up for any additional questions that you guys may have in regards to anything we've covered, from the redetermination to the member advisory board meetings, to the baby showers, to the value-added services, or to the micro grants that Western Sky is offering. Does anybody have any additional questions on any of those resources? All right, sounds like we've covered some stuff. So I hope some of you guys will reach out to me. I'd love to set up some meetings in the coming weeks, and look forward to continuing to join this meeting and be a part of this this particular greater group of the Health Council. So Wendy, thank you so much for the opportunity to speak today. Truly appreciate it. And I appreciate all you guys for lending me an open ear today. I hope this information is something that you will find beneficial. And again, I'll end on just asking for your help in sharing all of this. I'm sure this information is new to a lot of you. So as you can imagine, this is information that would be new to a lot of the people that you're serving. So your help in sharing this information is worth its weight in gold. So thank you guys so much for the opportunity to present today. And I hope you guys all have a great weekend as well.
Thank you, Chris. Can we get these PDFs?
I'll be emailing I'm actually going to work on it right now, Wendy. I'll get these sent to you, and then if you guys can take it, and if you need anything else, just reach out to me. But I'll certainly make sure you guys have everything shown here today.
A lot of information, and we'll make sure that you that this gets out to anybody who wants it. Carrie, our communications person, and I will work together to make sure that it's, first of all, on the website, but perhaps go out in some other in other fashions also. And then I'm going to put my email in the chat also, in case you'd like to get in touch with me. And Valerie, did you have a question?
Yes, I am looking at this Community Foundation website, and I just wanted to make a clarification. I don't know if this can be confirmed here or how familiar you all are with the website, but I just wanted to confirm that there is a distinction between a scholarship and a grant, correct? So when we're applying for a grant, that's the correct terminology, and a scholarship is a whole separate thing.
Yes, ma'am, you got it. That is right.
Yes. And if you on there too, if you have any additional questions, Valerie, the team at the Community Foundation of Southern New Mexico is super sweet, and they're very helpful. You can always give them a ring and say, hey, I learned about this grant. I have some questions on it, and I'm sure they'll be glad to answer any questions that you may have. They're traditionally open Monday through Friday, 8 to 5 p.m., but I know they stay really busy over there too. And I think they have like giving days going on right now, but nonetheless, feel free to reach out to them or myself if you have additional questions like, hey, having some trouble with the grant, need some help, and I can also work to have somebody reach out to you from there.
You know, I really appreciate this opportunity, because I feel like it's a great thing to allow preventionists, specifically in our department, the space to practice applying for grants at smaller funding, which it is usually equal to less of a, grant writing efforts, for lack of a better term. Like, it's a little bit easier to apply for micro grants than it is for big, huge grants. So yeah, I love having these opportunities and this knowledge to kind of pass on to other people or myself to really practice, not only apply for additional funding, but to practice the hard art of grant writing. So thank you so much.
Valerie, that's a very true statement right there. I am nowhere near wanting to ever be a grant writer, but some people have a knack for it. But yes, I appreciate you for those kind words. And Valerie, I hope that you can do me a favor. If you could send me an email you sound like somebody who we share a lot of common ground. So I'd really like to get to know you better. So if you'd be so kind, maybe you could shoot me an email and we can connect offline.
Yeah, absolutely. And I know that CHI is always looking for little bits of funding opportunities where we can get it. And I'm sure that a lot of our sort of efforts align. So yeah, I'll send you an email and I'll add you to my listserv.
Thank you so
Great.
much. And
And health councils, if you would like some help from the Alliance in applying for some of these grants, just send me an email and we'll get back in touch with you.
And one last thing, just big thanks to all the love in the chat. Thank you guys for your kind words out there. I really appreciate you. And Wendy, again, thank you so much just for the opportunity. Definitely
Well,
want to be
Chris,
working with
I'm
you
going to
guys.
say some more kind words. Chris is really out there. He is in the community and he means it, you know. Get in touch with him. He is very responsive. And as you can see, he's got lots of information, not just about Western Sky, but he's got lots of connections in this health arena. And he is a great connector and wonderful friend to get to know. So take him up on those offers. Thank you, Chris, as always. Thank you. And thanks to all of you. Oh, Valerie, yes, clap, clap, clap. And hearts, yes, Geraldine. So again, we'll make sure that this information gets out to all of you. In the meantime, if you have any questions immediately, either contact Chris, his email is in the chat, or me. I'll put my email in the chat once again. And don't forget, the critical information is that we got to get people either reinstituted in Medicaid or signed on to the marketplace. So that's number one. Okay, thank you again. We have a little bit of extra time. Does anybody have any quick announcements they'd like to make? Anybody?
Yeah, I'll make a quick announcement. I just want to introduce myself again. My name is Valerie Kling. The Grant County Community Health Council has recently fallen under a new umbrella, which is CHI. So all of the, I guess, tasks associated with their grants are now under our sort of supervision. So yeah, I just look forward to re-engaging and re-participating. And if anyone needs to reach out directly to the Grant County Community Health Council, I'm the person to contact. And I provided my email in the chat. So just wanted to mention that. Thanks.
Excellent. Thank you, Valerie. Geraldine.
Hi, Wendy.
Hello.
I was gonna just share that the Alliance will be sending out an announcement for the New Mexico Public Health Association. And so very quickly, that's this form here that's going out and being shared. We did speak with Leah and Tessa from NMPHA, and they're going to offer a scholarship to health councils. And it's only available for health councils only. So instead of paying the fee, there is an option to, I believe, get it free, to be able to attend the conference for free. So we'll send out more information by email, and it's only available for health councils. So we'll connect. If you're interested, email me or Carrie. But I think the announcement will be out there to let you know how to get more information.
Thank you, Geraldine.
No problem.
Any other announcements? One? No. Well, thank you all for coming again. Chris, thanks so much. Who's our person from Misty? Thank you so much for that important information. Thanks for all of you always for everything you're doing to make sure that we're all healthy. Maureen. Okay, how many folks can apply, Geraldine, from each health council? Do we know that?
We're still getting the final details, but Maureen, can you email me and Val, and we'll help you and get more information from Leah. It'll be a discount code you'll enter when you're registering. So I think as long as we get a head count from health council members,
okay,
I think it's fine. Just email
just
it.
to clarify, just so nobody thinks I'm trying to take advantage of that. It's not me, because I work for Department of Health and they are going to cover us going, but it would be 2 people with our health council. And I think they may have already applied. So I'm just gonna, if it's okay, I'm gonna email you, Geraldine, and those two people and say, hey, check with Geraldine regarding the NMPHA conference scholarship.
Sounds good. And do you know if they already paid?
Yeah, I'm not sure of the status. So that's why I'll connect you all and they can figure out where they're at. Thank
Okay.
you.
Sounds good. Yes, thank you. We'll send out an announcement soon.
And now you have all of our emails, Carrie, Gerald, and me. Our emails are all on the chat. So feel free to get in touch with any of us if you have questions. Any else? Questions or announcements? Comments? Again, thank you all for coming. Thank you all for everything you do. Let's stay in touch and have a terrific weekend, everyone. Stay healthy. Bye.